Hello, I'm Dr. Hanson with Hanson Chiropractic and Injury, and today we have Eric with us. Eric was in a car accident. He was driving home on highway, ended up planing, car spun, and then went backwards and then actually rolled completely over. So he had a compression injury in his neck and in his low back that damaged the normal curve that goes forward towards the throat in his neck, and then the normal curve that goes forward towards the throat in his lower back. The result is we found on stress films where we take x-rays under stress, we found instability in his neck where the ligaments are not holding the bones together properly, and as a result when he moves, the bones move in an abnormal way which irritates the nerves. Over time will cause early degenerative changes, damage to the disc, and so we're working on two things. We're working to get him feeling better and moving better, but most importantly, we're really working to help his injuries to heal correctly so he doesn't have any long-term residual issues as a result. So I'm going to show you how to do this. Eric, I'm going to have you go ahead and lay on your stomach face down, and I'm just going to take you through a treatment today so you can see our approach on these mechanical pain type issues, okay? So with Eric, his primary issue is in his neck, the loss of curve in the neck here, and then the loss of the curve in the lower back. And so I'm going to start by adjusting his SI joint on the left side. So Eric, I'm going to have you go on your right side down and face towards me. So most pain in the spine areas is mechanical. There we go. Let's go on the other side. And so it makes sense that if you have a mechanical problem, then the solution should also be mechanical. So our approach, the chiropractic approach, is to focus on the problem rather than just masking or covering the symptom with medication. There you go. There we go. Now I have to lay on your back here, okay? So we just released the SI joints. Those are the joints on either side of the tailbone. And by getting better mobility into those joints, that's going to help him feel better. I'll have you go ahead and sit up here. And now I'm going to work through the thoracic spine. Thoracic spine is the area through the mid-back, like between the shoulder blades. In his case, he tends to become too flexed, or what's called kyphotic, which is where he becomes real rounded here. So I actually want to lift those joints and bring them up. So we're going to do that this way. Yeah, that was a good release, wasn't it? Yeah, so that, again, that feels great. I mean, you feel pressure come out of that area, better mobility on the inside, and then we're going to work through his neck. And in his case, with this adjustment, I'm going to be working right at the very base of the neck, right where the rib heads from the top of the upper back come in and articulate, or there's a joint at the base of the neck. So I'm going to be working on that joint and then the joint just above that, okay? So basically the base of his neck, and right here. There we go. So we're releasing that. There we go. See, that released great. That moved nice, didn't it? Yeah. Yeah. Okay. And then this next adjustment, often the spine will become compressed, and that can happen from our activities of daily living. You kind of just almost innately feel compressed. Obviously, in a compression type injury, like in his case, basically the spine has become compressed and the joints are locked in that position. So this adjustment is called a Y-pull, and it's an adjustment that's along the Y-axis. So you have three axes, X, Y, Z. The Y-axis is the vertical axis. So I can adjust him, rotation, lateral flexion along the X and the Y-axis. This adjustment focuses on that Y-axis and decompressing the spine, okay? I'm gonna have Dr. Lyons come. He's gonna just hold his feet so he doesn't slide on the table. And I'm going to use this, we're going to put this underneath the base of his neck. And so this is going to be similar to the other adjustments where it's going to be a firm pull in the direction of correction, okay? nice deep breath in, and then all the way out. Just kind of let your belly drop. There it is, right there. That's it. Okay. That's a really deep adjustment, isn't it? Yeah, so that is, you'll feel that. Often you'll feel it all the way down, even down into the lower back. That really becomes our patient's most requested adjustment. When it's for that person, it's the right thing. There's nothing that can make a better change than that adjustment. It's a phenomenal difference, okay? I'm gonna have you go ahead and turn over on your stomach face down. And our last adjustment, so we're gonna be doing, is on your stomach here. I mentioned earlier about the need to improve the curve in his low back and the need to improve the curve in his neck. That's what's going to give his spine better stability, okay? So we're going to use the drop pieces in those areas that we just mobilized. Now we've got mobility into the spine, and we can start to shape it into a better position. So we're going to use the drop piece. I'm going to be working through that lower neck, really C5 or C7. Okay, and then I'm going to be working on his upper lumbar. So we're working on L2, L3 to bring this anterior. Good. Okay. Excellent. Yeah. Let's have you go ahead and come on up there, sir. Okay. So that is a more comprehensive adjustment. From here, we go to the rehab, which is traction and specific postural exercises to help to restore the normal curve in his neck and his low back. But this is a good demonstration of a comprehensive adjustment, including the Y pole along that Y axis. As far as what you felt, Eric, with the adjustments, if you want to just share kind of what you feel, how that helps you.
Okay. Well, the main thing is the lower back has always been really tight, and it's always been a challenge to get any movement from it. And I found that with the Y pull, it actually opens up the back. Like you feel it from the base of your neck. So if you have like tightness right here, it releases that tension, and then all the way down to the lower back. I've noticed that ever since the Y pull, when he does the side adjustment, there's actual movement down there. It's always been stiff, like Pete's been adjusting me forever. So. The other thing that's really nice is just the ability to like breathe easier after the adjustment it's great. Like
Yeah.
I mean, any kind of like tension you feel around your chest or like like when I stand up, it's just so easy to have proper posture after adjustment, and mobility in my neck is improved, and just overall it's just a lot of release of any tension.
Would you recommend it to anybody else out there?
The Y pull is hands down like the best thing ever. Like it's so shocking, but the release is kind of like when you crack your knuckles or anything. It's just awesome.
Yeah.
You feel like $100 after.
Right on.
Yeah.
Yeah. Very good. So that's a great example. Again, the principle is structure dictates function. So what you'll find is if your posture, your structure is off, that's going to affect how you feel and how you function. What Eric is seeing is we're improving his actual structure, and as a result, he's functioning better and he's moving better. So if you have any problems that we can help you with, or if you've been involved in an auto accident, please give us a call. You can find us at everettpainrelief.com, and we are here in Everett, and we're happy to take care of you. Thank you.